Good Saturday morning, everyone. Today on Perspectives, our focus is on mental illness and the immediate care of those who suffer from the disease. Medical officials say that too often those suffering from the disease can be pushed aside into living on the streets or even placed in local jails because of the lack of services. Mental health officials in Alabama are now addressing that concern by opening crisis centers in 4 locations around the state. Instead of jail or other enforced incarceration, law enforcement can now bring individuals to these centers for treatment. These same centers also accept patients who are brought into the facility by family or friends. And if a person feels that they need treatment, they can actually check themselves into the facility. Not only mental illness, but these same crisis centers accept people with substance abuse disorders. Now, currently, there are crisis centers in operation in 3 major cities of Alabama, including Mobile. Alta Point Health is Southwest Alabama's crisis center, while Birmingham is now the awardee of the 4th crisis center, which is considered to be a vital addition to the Alabama crisis system of care. State officials say that crisis centers are a crucial element of an integrated system of care. They say that these centers are a designated place for community members and law enforcement to transfer individuals to the crisis center. The crisis center can also be a stepping stone for further intervention and stabilization services for those coping with mental illness. Our guests this morning are Dr. Cindy Gibson, the Associate Director of Adult Crisis Service for Alta Point Health. In addition, Laurel Havert also joins us today. She works very closely with Dr. Gibson as the Assistant Director of Adult Crisis Service for Alta Point. We'll learn more on how physicians and health officials are dealing with the challenges of helping those with mental health issues as Perspectives continues after this quick break. Our guest this morning, Dr. Cindy Gibson. She is the Associate Director of Adult Crisis Services for Alta Point Health, and Laurel Havert, Assistant Director of the Adult Crisis Service for Alta Point Health as well. Ladies, thank you for joining us this morning.
Thank you for having us.
We're talking this morning about the Alabama Mental Health Crisis Centers, and let's go back a little bit before this all came about last year. A lot of us were concerned when we lost Searcy Hospital up in the northern part of the county in Mount Vernon. And of course, a lot of discussions about how do we handle mental health, how do we help the people who are having difficulties with not just the day-to-day things going on in their lives, but law enforcement. That was also another issue. And of course, several things happened during the period of time to where a lot of concern about we've got to do something better. Give us an idea of how we fared those last few years prior to this crisis center program getting initiated earlier this year.
Well, Searcy closing in 2012 definitely had an impact on the community. I myself worked at Searcy Hospital back in the 90s and never would have thought that it would actually close. But many people were released into the community, and we put some services in place with the limited resources from the state funding to try to assist with that, and part of that was our crisis response team and East Point Hospital. But over the years, as there has been more of an impact of mental illness in our community, those beds have gotten full, and our crisis team has not had anywhere to take people who may have just needed to be away from the house or family for a brief period of time. And more people with mental illness have ended up in jail simply as a means of getting them off the streets and having some place to keep them safe. And so bringing the crisis center into the mix provides an opportunity for those people to receive services and divert them from jails and emergency departments where they're warehoused waiting for hospital beds.
So would you say also that you and Laurel, being in that industry of service, could also see where there was a need and there were problems that were not being met at that time? Laurel, your response?
Yeah, I think it becomes frustrating when you see people that aren't getting the help that they need. and they're being incarcerated, or they're in medical hospitals where they're just sort of quickly turning over, and it's more of a Band-Aid. And what we're looking to do at the crisis center is not only do they get to meet the doctor and get medications, but we also have discharge planners there that meet with them from the moment they come in the door. So they're looking to eliminate any barriers that are causing them to not maintain compliance in the outpatient setting. So helping them find transportation to appointments, linking them to insurance, benefits, things like that. Medication, sometimes it's as simple as they're not compliant because they can't afford their meds once they get out of the hospital. And so giving them those resources in place, we're really trying to set them up for success.
Dr. Gibson, you mentioned in your first response there about seeing a larger, greater need here in our area. Is that related to some of the challenges that we have between the storms and, of course, being here on the Gulf Coast where the cost of living may be too great for some people as well? What seems to be our issue here?
We do have a pretty significant homeless population, and I think we definitely get a higher seasonal homeless population because of our climate. And I think people are also drawn to the coast. People with mental illness, seek out locations that they feel are soothing, and so I think as COVID has impacted us and people have lost their jobs or resources have become fewer, the impact has been more significant over the past year, and even leading up to that, the number of people arrested with mental health issues, or the number of calls that law enforcement responds to that are really mental health in nature have increased.
Now, our first 3 crisis centers were awarded funding back in October of 2020, so of course during this COVID pandemic, and you were able to become operational in May of this year. I guess you could almost say this was very timely. And did this funding, some of it come from the pandemic funding?
Not originally. This had been in the legislature prior to COVID, and COVID actually slowed the process down a little bit. But fortunately, the vote went through despite all of that, and the Department of Mental Health, the commissioner, was really, very aggressive in pushing for this to happen. And we're very fortunate that it did go through during a really tough period for us. So it's just a fabulous coincidence.
I know in some of the information on the Alta Point website, you talk about everyday living and all the pressures and responsibilities can be tough, regardless, of course, of your status or outlook on life. Lauren, give us an idea of who you are helping.
Really anybody that is in need of getting started on medication in a safe environment, who possibly doesn't know what resources are available to them within the community. I know before I started working in mental health, I didn't really know anything about what people had available to them, and based on their income, their insurance, stuff like that. And it's a really good place to go and get all of that. And it can be anything from psychosis to severe depression, that they just need somewhere to go and to see a doctor and to be safe.
Now, you talk about it being transformative. When life struggles are too much to bear alone, relevant treatment can be transformative. And that's what a lot of folks need, I guess.
Yeah, they need to know what's available to them. I think you don't know where to start if it's something that just occurred, with all this stress and unemployment and people getting sick, and you don't know where to go. And so it at least gives you a starting point, and then we try to follow up and make sure you know what's available to you so that you can get help.
Well, I noticed that some of the information ties in mental illness with chemical dependency. Dr. Gibson, how are those connected?
Well, a lot of individuals who have mental illness do use substances as a means of coping with their symptoms. So for somebody who's experiencing psychosis, they may feel like marijuana or other drugs may tamp down the voices, and it becomes a pattern of addiction over the course of time. And so the two become very intermingled, and sometimes it's a question of which came first. Somebody may be experiencing a substance use crisis, and the effects of substance end up resulting in mental health symptoms, or there's a psychotic breaks sometimes do occur around the same time as drug use, just because people are in that age of experimenting, and schizophrenia, the onset age is between 18 and 26.
Some great information, ladies, that you all are sharing. And of course, we're going to talk also about the law enforcement connection here. Laurel, you addressed that, as well as Dr. Gibson talked about that earlier. And we're going to talk about the jail diversion program that you have as well, and how you are working with law enforcement to make a difference in our community. We're talking this morning about our crisis centers that are in place now throughout the state of Alabama. There are 4, the Alabama Mental Health Crisis Centers. And we'll talk more about that on Perspectives when we continue in just a moment. Welcome back to Perspectives. This morning we're talking to Dr. Cindy Gibson along with Laurel Havard. They're both with Alta Point, and we're talking about the Alabama Mental Health Crisis Centers. And we talked earlier about how those centers are now engaged and working in the communities, 4 different ones across the state. And of course, Alta Point is the one here in our local area here in Southwest Alabama. How many counties are you servicing? How many people are coming in from the different areas surrounding Mobile County?
We service 7-county area in our region: Mobile, Baldwin, Washington, and then 4 counties that are covered by Southwest Mental Health Center in Escambia, Clark, Conecuh, and Monroe County. And so we see individuals from all of those counties, and the primary is, of course, Mobile.
Now, it's said that the crisis centers are a crucial element of an integrated system of care. Why is that?
Absolutely. Because without the crisis centers, we often don't have a place to take someone who is in need of some treatment outside of what they're getting in an outpatient continuum, but they don't quite meet criteria for inpatient hospitalization. So this provides the missing link to get people to engage in voluntary treatment, where somebody may be unwilling to go to an acute hospital for a week or 2. They may be willing to come into the crisis center for a day or 2, and we can get them stabilized on medications and back into the community where they're comfortable and have supports.
And I would assume, Laurel, that these places look a lot different than some of the old places that we have in mind, even times at Searcy, but from the movies and other things of what we saw for mental health treatment, you've got a different look and a different setup now.
Yeah, we try to make it really calm, really comforting. It's basically, in our temporary observation unit, it's 15 reclining chairs that are set up in a semicircle with a nurse's station in the middle, so they're always observed by the nurses, but we keep real calming, kind of classical music playing, things like that, because a lot of times our patients that have been hospitalized before, they really associate that with a loss of autonomy and being forced into treatment, and we really want people to be coming in, getting treatment on their own terms, and we want them to always feel like they're engaged where they are in their road to recovery. And in order to be more successful on the outpatient side, we find that it's more likely for a patient to follow up if they have a good experience with us, as opposed to coming somewhere and feeling like everybody's making them do something they don't want to do. You're going to be more successful if you've bought in and you feel like it's on your own terms.
Very good point there. Now, the crisis centers are considered a designated place for community members, law enforcement, and first responders to take an individual who's in a mental health crisis. And we wanted to talk about the whole law enforcement perspective, because a lot of family members have talked to us in the news after incidents have happened to where that was not what they wanted to happen, and that's not what they had an idea would happen. And yet, though, because not everybody is equipped as you all are to handle these crises, how is this making a difference as you work with law enforcement and first responders?
Well, It's very integrated with first responders and law enforcement because that's where we want to make an impact. Law enforcement are often the de facto first responder in a mental health call, and they end up having to assume the role of therapist or case manager, and we want to get people the treatment they need where they need it. And we've worked with our law enforcement partners and the emergency rooms to develop plans so that law enforcement can do a direct drop off to us rather than having to take someone to jail or send them by ambulance to an emergency room and accrue a big ambulance bill. When somebody goes to an emergency department for psychiatric services, often they sit there for a very long amount of time before they get any service, and it's not really psychiatric in nature in most cases. That's a medical hospital designed to treat medical issues. And in terms of law enforcement, law enforcement are not trained in how to respond to individuals with mental illness, and they shouldn't be. They're police, and they're there to protect the community, but they do end up in these situations. And so we are working with Mobile PD in particular on a project for training for law enforcement and co-response, where a clinician would actually respond on scene and assist with those calls so that we can free law enforcement up to handle public safety concerns, and we can reduce the number of individuals who are going to jail with a mental illness for non-violent, non-sexual crimes. And when an individual does go to jail with mental illness, they're more costly to the system, they're more likely to spend greater lengths of time in jail, and more likely to recidivate.
Those are 2 points that I wanted to ask you about, and you definitely pointed us in the right directions. We talk about the training with law enforcement, and then number 2, to where they are now having a better understanding that you've got somebody available to help them as well to hopefully calm the system or the incident down before it explodes into something else. Laurel, how important is that in this picture that we were talking about?
It's incredibly important. It's for the safety of the officers, for the patients, and for the community at large. It benefits everyone if somebody's receiving the right kind of treatment. As Dr. Gibson said, people aren't getting what they need if they're sitting in jail when they really need to be on medication, meeting with a doctor, possibly talking to a therapist or someone to help them eliminate the barriers that led them to their current crisis state. And on top of her saying, recidivism and all that, people are also more likely to get victimized while in jail that have a mental illness. So you're adding trauma on top of something that's already an illness in place.
My goodness. And that training with law enforcement, Dr. Gibson, how is law enforcement responding to you? Are they waiting for you to say, let's do this thing, let's get it right?
Yeah, I think it's something that law enforcement definitely is wanting, and they know that they're the first responders. They know that they're having to deal with these things, and that they're ill-equipped, and through no fault of their own, and so they're eager to receive training and learn how to effectively manage calls, and certainly for the co-response portion to be able to hand those calls off, or to not have to respond to those calls at all as we move towards a 988 system next year. I think that the designation of a mental health call can trigger a response by non-police in the future, and that's certainly more beneficial to individuals and their family members, and public safety in general.
We've got about 45 seconds left. Would you take a moment and talk to families who are watching this to tell them how this is here to help them and how they can reach you?
I think it's really important for families to realize that this resource is here, and if you have someone in your family who's experiencing a crisis, this is an option. And convincing them to go to a facility for 23 hours is certainly easier than convincing them to go to an emergency room or to go to a psychiatric hospital. And so we're here for you, calling our Access to Care line and talking through the issues, and getting linked to services through the Crisis Center is important, and hope to be a resource for families.
Dr. Cindy Gibson and Laurel Havard, we thank you both so much for coming and sharing this information now. It sounds like much better days are ahead as we look forward to the Alabama Mental Health Crisis Centers playing a big part in helping those in the community who are in need of these services.
Absolutely.
Thank you so much for joining us here this morning on Perspectives. And for more information on mental health crisis centers, as well as what services AltaPoint Health offers as well, now you can visit their website at altapoint.org. You can also give them a call at the phone numbers you see there on the screen, 251-450-2211, and the toll-free number is 888-335-3044. And remember, though, in case of emergencies, please call 911. Next up on Perspectives, Veterans Day is this coming Thursday. And did you know that we live in a state and region where men and women accept the call to serve? Nearly 400,000 veterans are accounted for in the state. And here in southwest Alabama's 7 counties, officials say that there are 75,000 former U.S. military service members and retirees who call our area home. We want to know how, after they've given so much, how are their needs being met as they live out the rest of their lives? The state of Veterans Affairs for our men and women who served and gave of their youth for our country. We'll hear from the veterans who are active in making sure that Alabama's veterans are and their needs are all being addressed. Well, join us here next Saturday morning for Perspectives at 8:30 a.m. as we discuss important issues and seek solutions. Of course, if you want to drop us an idea, drop it to Perspectives at Fox 10 TV. I'm Eric Reynolds. Have a great week.
Thanks for watching Fox 10 News. Watch us live wherever you are, on our mobile, our streaming news app, and you can also watch us on Roku, Apple TV, and Fire TV.